to yet another exciting episode of Constituency Talk. I'm your host, Delio Ropafazomaka. Today we are in Vungu constituency in the Midlands province, where Honorable Omega Sivanda is the National Assembly member. The first case of COVID-19 was registered in March 2020 here in Zimbabwe. The rural population has not been spared. But how has this affected the rural community?
Lokho kuqalisa umkhuhlane weCovid lo okade singawazi. Impilo kayisemnandi njengakuqala ngoba kasisela freedom yokuya lapha esiyakhona. Lokudla ungaze ushotelwe ukudla ugcina usesaba ukuyathenga lokuya etown sesaba khona ukuthi uyabungaza ukuthi lapho uhamba khona umkhuhlane lo ukhona kumbe hayi. Okubuhlungu kakhulu ukuthi nxa umuntu angagula engekhaya so kufuneka sibili abuye lapha eclinic kube sokuthiwa gaye esibhedlela lapho kulobunzima khona indlela zokuhamba kufanele siqale semapholiseni siyothatha incwadi khona pho umuntu engxenye kuyabe asikwazi ukuthi kuyabe kuserious okunganani. So iCovid le ibuyise ubunzima obuthize ebantwaneni besikolo. Abantwana besikolo sebediniwe ukuthi thina sibafundise ngekhaya abasafuni sebesitshela ukuthi hayi uteacher wayengasifundisi so ungaze uzame sibili ukuthi hayi bhala so yena usefuna umbalisi wakhe. So abantwana sesiphungu bayekela babali nje okuningi vele kasisakwenzi.
Sifo lesa hayi sikhanakala sesimise izinto eziningi. Isikolo sezimi kakusafundeki kahle labasebenzayo abasasebenzi ngendlela efaneleyo.
Umkhuhlane okhona sibili ophilayo abanye abantu abakuzwisisi kodwa ngibona umkhuhlane lo umkhuhlane oyingozi kithi. So kudinga thina i-community ukuthi sibambane labantu sitshengise abantu ukuthi into le iyaphila. So sizama ukuthi kakube lento eyenzakalayo sibili ukuthi sibone ukuthi sigcinekile sonke. Lo ngazwisisiyo simenze azwisise ukuthi into le iyingozi. So sizama ukuthi alibana sonke singaba inhliziyo yinye senze into esizwisisayo evela kuhulumende sizwisise ukuthi sihlale sizivikele.
But what is it that Honorable Sivanda is doing to ensure that his community is not at a higher risk of contracting this deadly virus?
Seeing the pandemic that is COVID-19, the spread of it, which it was doing, and considering my constituency, and knowing very well that we didn't have resources in this constituency, to sit down and think about our people first, what our people were going to do when this thing attacks Vungu constituency. The next thing I thought of the very people who come from Lower Gweru, Vungu constituency at large, who are based all over the world, in particular United Kingdom, New Zealand, Botswana, Australia, so on and so forth. They responded very well. The local guys who come from Lower Gweru, the guys who are based in the diaspora. We mobilized funds.
Using the power of technology, Honorable Sivanda linked up with the people of Vungu in the diaspora who dug deep into their pockets to ensure that their families back home get to receive the required personal protective equipment, PPEs, for the frontline health workers.
When people I work with heard of the plight of the people back home and the lack of resources to tackle the COVID-19 pandemic, they decided to chip in and help with gloves, face masks, aprons, and sanitizers for frontline healthcare workers. We hope to continue to assist where we can, and we realize that the task to improve access to good healthcare for our people goes beyond just this pandemic. I'm proud of the work that many people are doing to support our people back home, and I would like to continue to encourage all of us to dig deep and to try and help, particularly in this time of need. I want to encourage you all to follow the advice of health authorities in the country, and in particular to protect the elderly and vulnerable by practicing safe distancing, hand washing, and where necessary, wearing face masks.
Popular former radio presenter and brother to the legislator Ezra Sivanda, who is part of the Vungu children in the diaspora, urged people to follow the set regulations to stay safe of this pandemic.
As Zimbabweans, we got together, sahlangana, sazama ukuthi sithole imali to help people, to equip our clinics. We are working with the Honorable MP. So we decided to get together, we fundraised, and then we bought PPE, which we sent to our Honorable MP to deliver to our clinics. Our clinics in the province, in the region, they need to be equipped to be ready for this pandemic, which is attacking the whole world. World Health Organization guidelines are very clear. Basitshela ukuthi garai mudzimba dzenyu, hlalani ezindlini zenu. Please stop moving around. Follow the government guidelines. All over the world, we do follow the government guidelines. Sizinanzelele, sigeze izandla, sihlale sihlanzekile, sizivikele ngokuhlala emakhaya.
Let's go for a short commercial break while we sanitize. Welcome back. The Minister of State for Provincial Affairs and Devolution in the Midlands Province, Honorable Larima Vima, thanked the children of Vungu in the diaspora for sourcing personal protective equipment for their health centers back home. He was speaking at a handover ceremony which was held at Lower Gwelo Clinic.
Ukaona mwana anofunga kwaakabva, mwana akarerwa zvakanaka. Azirevi kuti kwavari koko hakuna chigwere icho chichi. Kwavari koko chitori worse than kuno. Asi wafunga kuti ko hama dzedu vedu wei ziri kuita sei. They realize the difficulties that we are facing here as a nation. They realize kuti economy yedu haina kumira zvakanaka. They realize kuti vana baba nana mai vari kutambura, musha kune zhara, zvinhu zvakaoma. Saka nezvishoma zvatinazvo ngatitumidzireyo kumusha vanobetsera. Aiwa toti Mwari ngavakumbore.
He also took time to chronicle the country's COVID-19 journey so far and urged people to follow the government guidelines for them to stay safe from this pandemic.
When the pandemic started, our numbers were very low. I think for a very long time, we stayed around 10, and with 4 deaths for more than almost a month or 2 months. The numbers didn't change. But then when we started getting vana vedu who are in South Africa, in Botswana, Namibia, overseas coming, being forced to come, being deported from those countries, most of them, the government, through the leadership of our president, said we cannot refuse our own. We have to take them here. We have to take them back home. But there are certain conditions which they have to meet. My conditions are that they must go into the quarantine centers for a period of time where they will stay and then they will get tested. Kana vatestwa, if they are found to be negative, wonzi ngavachaenda kumusha voenda vonobatana nemhuri dzavo. If they are sick to the extent yokuti havakwanisi kuenda kumusha, they are then hospitalized. This is why we have Yama isolation centers. There are different types of isolation centers. One, those that are found to be positive, asivasina kukunogara o kumba kwavo akuite kuti vagare nokuti kune vanhu vakawanda kare vanozopedzisira vaita sei vatapurira chirwere ichocho kuna vanhu ivavo. They are then kept in the isolation center until they get better. And then goes at the second stage, what we call the isolation and treatment center. That's where you find someone anengari infected achigwara. But kugwara kwacho is not critical. Iyo munanenga kadaro, we put them into that center, and so far we have 2 or 3 that are operating. We have Koba 1, Gweru, and we have another one which was commissioned by Vice President Mohadi 2 weeks ago, the infectious diseases hospital in Gweru, Ascot. And then this third level, which is what we call the high critical care. That's when where they are put on machines to sustain themselves, and that is at the Gweru Provincial Hospital. That is almost complete now, but all of these that I'm talking about, they are able to carry people. Now, how do we protect ourselves as a community? That is the most important thing. Our numbers were low, but these numbers, all of a sudden, they are shooting up like this.
The Minister of State also thanked Honorable Sivanda for bringing together the leadership of his constituency, as they were the ones to carry the message of COVID-19 back home.
COVID-19. And I'm very happy, Honorable MP Sekuru, kuti maunganidza leadership pano, vana Sobu, vana councillors, chief staff vari pano, the frontline workers vari pano, political leadership iri pano zvakare. These are the people that should go out and give information about this deadly disease that we are facing, and how, for the time being, we can prevent it's not kuti it's going to be like this forever, but it's not also going to be what it was before. We have to get used to a new way of doing things, a new life. You know, the new normal.
The National Assembly member for Vungu constituency is happy that his constituency has not recorded any COVID-19 death, but is worried of the uncontrolled movement of people into his constituency, which he feels might end up bringing the disease to his people if it continues.
We don't have any COVID death in this constituency where we are. Of major worry, Honorable Minister, it is to do with people are commuting all the way from Bulawayo. There are some illegal pirate taxis which come from Bulawayo to this area, because most of our community or our people who reside from this place stay in Bulawayo. So as we hear the figures going up in Bulawayo, it worries us to see these people uncontrolled coming to the community. We are scared as Vungu that this might infect people who are here in this community of Lower Gweru Vungu constituency. So we are requesting through your office, Honorable Minister, that these people or these combis which plied the route from Bulawayo to here or Harare to here, can they be controlled? Because the movement is too much, Honorable Minister.
Honorable Sivanda underscored the need to make sure that COVID-19 does not reach Vungu. He also thanked the people of Vungu in the diaspora for stretching a helping hand to the constituency in the face of this pandemic.
We want to protect our area, Honorable Minister, to make sure that it doesn't reach this place, because we cannot afford to contain it. And also, Honorable Minister, myself, through my friends in the diaspora, we have managed to source the items which I discussed with you some time ago. There are quite a number of things There are people from the diaspora, the UK. We've got our community there. Our people from this area, they are there in the UK. They are there in New Zealand. They are there in Botswana. They are there in Australia. We are so grateful about these people. Bakwanisile, Honorable Minister, to gather the resources they had to make sure that we get what is in front of you, Honorable Minister.
An assortment of personal protective equipment ranging from sanitizers, masks, gloves, thermometers, shields, and many others was sourced from this initiative, and all the 11 health centers in Vungu received the items. The frontline health workers also received mealie meal from the Minister of State. Some of the children from Vungu who are in the diaspora have even vowed to adopt some of the clinics and provide medical supplies. We are going for a short commercial break. We will be right back. Welcome to the third and final segment of Constituency Talk. A lot more needs to be done, but the frontline workers are happy with what Honorable Sibanda has done.
I would like to thank those people who made frantic efforts to facilitate the donations that we've got here at Lower Gweru Mission Clinic. What we got encompasses the personal protective equipment that is required by the frontline responders who are our healthcare workers to ensure that we prevent infection getting our healthcare workers infected with COVID-19. Infection prevention and control is an administrative priority for us, so this donation will go a long way in assisting especially our rural health center in Vungu constituency.
Siyabonga kakhulu thina abaphathi bezigaba ngosikwenzela ngo-MP wethu ngumntwana esimzeleyo oselo wagwelo kodwa uyakhumbula indawo yakibo ukuthi ayiphakamise layi. Siyathaba ngalokho asenzele khona ukusinxusela uminister ukuthi babuye bezefundisa abantu ngomkhuhlane lo osimemetheke kangaka ukuthi sazi lathi ukuthi sizigcine njani ngomkhuhlane lo owe-COVID-19 pandemic.
The Chief Executive Officer for Vungu Rural District Council, Mr. Alex Magura, emphasized the need for such donations, especially at such a time when the cases of COVID-19 are on the rise.
We will require more such assistance. We realize that this time cases are going up, and we don't know when the situation will stabilize. Therefore, it is important that we continue to get more such assistance so that the health staff in the district is well equipped to deal with the pandemic. We hope as we go into the future, like I'm saying, we'll continue to get such assistance.
Honorable Sibanda took a tour of the 11 clinics in his constituency to confirm receipt of the PPEs. The frontline health workers also thanked the National Assembly member for the good work he has done.
Chekutanga da kutenda Honorable Sibanda wakati kwanisa kuti wanira PPE yoi tachito ne stress saka chokwadi kubva zvatanga COVID tatisina zvekushandisa tachitongotya ende isusu sesu paclinic pedu we have never gone per strike. We've been working since atinamborega kushanda, but tachitongotya every day as patients come in tichiva attenda tisina kana chinhu tichingoriwo nezvemamaski zvatatazongogadzirawo kuti tikwanise kubetsereka. Saka we really appreciate.
Tanga tiine challenge personal protective equipment PPEs, saka tafara zvikuru Honorable MP vachitibatsira nema PPEs, vachitibatsira nema sanitizers, vachitibatsira nema masks, vachitibatsirawo nema infrared thermometer aya tinoshandisa pakutora vanhu kana vachipinda paclinic panapa tione kuti matemperatures avo akamira sei.
Kuna unonza chakuna kunisina mukhana ukuthi tibatwa no-COVID-19 especially patechisanga nema-ANC members.
Honorable Sivanda urged people of Vungu to continue practicing good hygiene to curb the spread of COVID-19.
Because of the consciousness and people practicing what the president is telling them or us every day, that we should practice social distancing and avoid moving all over unnecessarily, and put on our mask, wash our hands every time we can, as many times we can, and making sure also that we don't transmit, if you've got the disease, to the next person. This is the message which we spread to our people, and they follow that. And I'm glad, as I said, to tell the nation that Vungu is a COVID-free zone, the constituency of choice. All is well here at Vungu at the moment. But we keep avoiding. The only worry is to do with the combis which come from outside these constituencies, especially this constituency, especially Pulawai. People are coming here and we are worried. The law must take its course, that is to do with Z-therapy, making sure that roadblocks are put and people must produce letters of authority to move around the country. Remember, the intercity travel is still banned. So if you get people coming here to Lower Kweru, Vungu, Somabula and other areas, people, I urge them that if somebody comes, a stranger or even a relative, come with those who have been in South Africa, please tell them to go back and produce their certificate from the Ministry of Health that they've been quarantined and proved to be COVID-free.
That's all we had for you in this week's episode of Constituency Talk. If you'd like us to visit you in your constituency, please do get in touch with our producers. From me, your host, Deliwe Ropafazomaka, and the crew behind the scenes, God bless you.